First of all, what I would like to begin by saying is I'm very thankful to the leadership in the process that this whole debate has taken. They had the very wise judgment to send us home early last night at 2 a.m. rather than take up the bill at that time. And like many bills that are discussed at 3 or 4 in the morning, I thought it was a very good decision to take this bill up today. We're in our 4th hour right now, and God only knows how everybody would have been at 6, 7 a.m. in the morning if we had continued through the night. So I'm very, very thankful to that. This has been a very, very long process for everybody. But the long process is something that we're used to. You know, we're here every week. We debate bills all the time. But for the people in our communities that don't do this every day on every issue, this has really been a journey, and an arduous journey for them, because this is something that's very unusual in their lives. They lead much more normal lives than we do, and they're to be commended for their advocacy on this issue. This has been the one issue in my 5.5 years here, bar none, that we have spent the most time on discussing. I would say that this has lasted from our very first meeting here in January up until the middle of June today. We talked about it before the budget, during the budget, and certainly after the budget. We all have had many, many private meetings in our offices with constituents, with advocates, with doctors, with people from substance abuse agency, and we receive so much contradictory information. This is great, this is not great, there are risks, there are no risks, and we have to have that filter. I'm sure, again, just speaking for myself, have had many town hall meetings where people have come and expressed their views. So there's been no shortage of, number one, information, and number two, time to deliberate and discuss this issue. Now, some may accuse me sometimes of being a little bit deliberative and slow in making a decision. And I actually pride myself on that, because I like to filter all the information. And sometimes people don't like when you are deliberative and you're thinking about things. They want to know, are you for it, are you against it? But that's not the way that this system works. When there is a lot of information here, sometimes people are slow to make decisions. And I think that's a good thing rather than a bad thing. Now, I agree with many of the earlier speakers when they talked about those concerns, because I share those concerns, and I've expressed those concerns in terms of the specific serious illnesses that are listed in the bill. And if I was writing the bill myself and I could craft that bill, the bill would be a little bit different, but this is, again, the collective effort of many, many minds and many, many judgments. But I share those concerns about the list of the list of illnesses that are in there. I also share the concerns about whether or not this is going to work, and should we wait a little longer until we have clinical trials and the like. Well, I'd like to make 2 points on that. The comment was made that we're 18 months out, and in order to get to the end, you have to start at the beginning. So if you don't start at the beginning, whether it be today or yesterday or the next day, you'll never get to the end. So if you waited until next year or the year after that, then you're 2.5 years out, 3.5 years out. So I do feel it's very important to get started. Now, do I share the concerns about how effective medical marijuana is going to be? I do share those concerns, because I'm not convinced by the medical evidence. But one thing that I know is that when you talk about some of these illnesses that are in here, and I'll mention epilepsy specifically, right now many of these people are taking drugs that are approved by the FDA, whose drugs have gone through clinical trials, and they've been vetted. And the outcome of all of that science and all of that medicine and all of that time is that many of these medications that are prescribed to deal with these illnesses are not working.
Right.
So then where do you go? Now, I am blessed or lucky that I don't have a family member right now suffering from one of these illnesses. And I did not have a child, and my children were younger, that suffered from epilepsy and had the symptoms of seizures. And I can't imagine what it's like to go through that. I just can't. I can't put myself in the shoes of these parents that have to deal with this on a day-to-day basis. But one thing I do know is that if I was in their shoes, I would want some help. Is it going to work? Are you going to get a guarantee? I don't believe you are. But I do believe that we are at the point that, and I wouldn't call it false hope, but I think you have to weigh, are you giving false hope versus no hope? What do you do when you have a child, as Senator Grazzani said, when the medicines that you are prescribed by your physicians who are experts in the field don't work? And that's what we're doing today. I think we are providing opportunity. We are providing hope. Are we providing compassion? Perhaps. But we're giving people who right now feel hopeless and at wit's end and don't know where to turn, we're giving them a very structured, constricted mechanism where a year and a half down the road, and they know that, they may be able to get some relief from their child or for their child. So is this a no-brainer? Certainly not. Is it a 55-45 decision? It is, like many of these issues that we face are. But I come down on the side of trying to give some hope, maybe it's a glimmer of hope, to something that is going to help some of these families with some of these conditions which they are living with every day. Thank you, Mr. President.